So basically, our body, okay, it's our body, whole body. It is covered by one layer that is called skin. ठीक है, जो हमारी बॉडी है वो एक चीज से ढकी हुई है जिसको हम कहते हैं स्किन। ठीक है, तो स्किन जो है आपको दो हिस्सों में बटी हुई है। ठीक है, कितने हिस्सों में बटी हुई है? हाउ मेनी layers are there? We have two layers, cutaneous and subcutaneous. You can also see here, this is the skin. If we cut down the skin, from one piece of skin is taken away and we are seeing under the microscope, so how it's look like. So ये थोड़ा हम स्किन का हिस्सा निकाल के बाहर अगर माइक्रोस्कोप के नीचे अगर देखेंगे तो इस तरह स्किन नजर आएगा। तो इतनी चीजें होती हैं सिर्फ हमारे स्किन के अंदर। तो ये जो स्किन है, इट इज डिवाइडेड इनटू टू लेयर्स। वन इज cutaneous. Okay, this is cutaneous. From here to here we have cutaneous. Okay, and this is subcutaneous. Okay, again the cutaneous is divided into two layers. One is epidermis and second one is dermis. So this is the epidermis one, first one, and second one is dermis, epidermis and dermis. So basically the skin is divided into two layers, cutaneous and subcutaneous. और क्यूटेनियस फिर दो हिस्सों में डिवाइड होता है, एक है एपिडर्मिस और एक है आपका डर्मिस। ठीक है, ऑलरेडी स्किन के चैप्टर में कंप्लीट हो गया, तो अगर कुछ है आपको तो वहां पे आप रिवाइज कर सकते हैं। ओके, so the dermis of the skin and the subcutaneous tissue contains receptors for the sensation of touch, pressure, heat, cold and pain. So basically यहाँ पे इसलिए जिक्र किया जा रहा है क्योंकि क्यूटेनियस में यहाँ पे receptors होते हैं। Receptors means whatever information you have, it will receive. Okay, it will give to the internal neuron. Okay, so the cutaneous, sorry, the subcutaneous have receptors. What they have? Receptors. You can see here that this is the receptor, one receptor. This is the pressure receptor. What's its name? Ruffini corpuscle. And this is pressure receptor. Okay, Pacinian corpuscle. Okay, next here we have touch receptors. This is in dermis. Okay, Messiner corpuscle. Okay, these are the receptors you can see here. Okay, and here we have temperature receptors. These are the nerve endings. Okay, you have receptors. Here we have touch receptors. Again, we have touch receptors. Okay, so these are the multiple receptors are present in a dermis and subcutaneous. Okay, so first receptor mostly are present heat, touch, sensation, whatever sense you have, that is mostly present in subcutaneous tissue. So ज्यादातर जो हम सेंसेशन करते हैं ठंड का, गर्म का, दर्द का, और किसी चीज का प्रेशर का, और किसी चीज के टच का, ये सब चीजें आपको डर्मिस और सबक्यूटेनियस में मिल जाए। The receptors for pain, heat, and cold are free nerve endings. So already explained, these are the free nerve endings. Okay, these are the free nerve endings, which also respond to any intense stimuli, intense pressure, for example, may be felt as pain. The receptors for touch and pressure are encapsulated nerve endings, meaning that there is cellular structure around the nerve endings. So basically, these are the nerve endings. So one nerve is coming. Okay, this is the endings are which are situated on dermis. Okay, so you can see here these are the cells also which are connected to the nerve endings. Okay, these are the touch receptors. Okay, so I am touching with my pen. So basically, what have the touch receptors which are present in the dermis or epidermis? So these are the taking the information from the nerve. Okay, this is the nerve, neuron. Okay, then it is reaching to our brain sensation area. Okay, The receptor. The cutaneous senses provides us with information about the external environment and also about the skin itself. Much of the information about the environment is not of great importance and is processed at subconscious level. So you choose to be aware of it. For example, could you distinguish a cotton t-shirt from denim jeans by touch alone? Probably, but you might not realize that you can do that until you try it by, say, sorting laundry in the dark. If you were walking barefoot, could you tell if you are walking on a carpet, a wood floor, concrete, or beach sand? Yes, you could. But so here what explaining that. So basically यहाँ पे जो डर्मिस है यहाँ पे ही आपको क्या है, टच रिसेप्टर्स मिलेंगे। और कभी कभार क्या होते हैं, ये टच को आपको ज्यादा महसूस नहीं होने देंगे। जब आप कॉन्शियसली कॉन्शियसली चाहेंगे कि मैं ये इसको छूं और महसूस करूं कि ये क्या चीज है, तो जब तक आपको वो अनकॉन्शियस लेवल में उसको रहने देता है। जैसा कि अब आप हम कपड़े पहनते हैं, ठीक है। अब क्या हम ये शर्ट है, पैंट है, तो आई एम नॉट अवेयर दैट आई एम ऑलवेज हैव टच सेंसेशन। सो इट इनिशियली आपको टच का एहसास होगा, लेकिन जैसा जैसा वक्त गुजर जाएगा आपको महसूस नहीं होगा कि आप क्या है आपके ऊपर, आप एक कोई वजन उठा रहे हैं। तो एक अनकॉन्शियसली इट इज गो थ्रू, ओके, बट suddenly you remove your shirt, again you feel some touch sensation because you are removing your shirt. So likewise, when another example is given, if you are walking with your sandal or any shoe, so probably you will not feel the what type of road is that. Okay, if you are walking on the carpet, if you are walking on the sand, or if you are walking on the concrete or wood floor, when you remove your sandal, when you remove your shoes, you can touch the sensation. Is it concrete road? Is it wood floor? Is it sand road? Okay, so you can aware of that. ओके, सो ये सब चीजें क्यों हुई है? क्योंकि आपका जो टच है, जो आपका फूट है, वो उस टच को महसूस करके ब्रेन के सेंसेशन एरिया तक पहुंचा रहा। ठीक है। तो ये डिफरेंट डिफरेंट क्यूटेनियस सेंसेस है जो हम हमारे डेली लाइफ में बहुत ज्यादा यूजफुल है। सो दीज आर द डिफरेंट टाइप्स ऑफ सेंसेस वी एक्सपीरियंस दिस टाइप ऑफ सेंसेस इन आवर डेली लाइफ। ओके, but are we usually aware of sensation from the sole of our feet? If all is going well, probably not. Some people with diabetes develop diabetic neuropathy, damage to nerve that impair sensation, and they may say that a wood floor feels like walking on cotton balls, or that the buttons of a shirt feel too large or too small. They are aware of such overt sensations simply because the feeling are odd. For most of us, the touch of wood floor is not brought to awareness because it is what the brain expects from past experience. But if the floor has splinters or if the beach sand is hot, we are certainly aware. This is information we can bring our conscious mind if necessary, but usually do not. So here one another example is given, that one disease that is known as diabetic neuropathy. So यहाँ पे एक एग्जाम्पल दिया जा रहा है कि डायबिटिक न्यूरोपैथी पेशेंट्स में कैसा महसूस होता है, हाउ दे फील दैट व्हेन यू वॉक ऑन द वुडन फ्लोर, they feel like that they are walking on the cotton road. So why this happen? Because these are the nerve endings. Okay, these are the touch receptors. So what will happen that due to diabetic, they are damaged. They are damaged because excess of sugar. So what the diabetic is nothing but the our cell need. Diabetic क्या है? Our cell need, this is the cell. Okay, so every part of the body is made up of by cell. Different types of cell are there. So our cell daily need oxygen and energy. Okay, energy, what they need? They need energy. Okay, they need energy. how the energy is produced. The energy is produced by glucose. Okay, by glucose only. So if the cell doesn't getting enough glucose, so how the energy will produce? So the energy level of cell is decreased. So here we are explaining that the touch receptors is also is made up by cell. So he is getting proper enough oxygen, but not glucose. Glucose is on the blood, in the blood only. It is not reaching to the nerves. So what will happen? It will not get enough energy to work. Means it will not enough sensation. Its work is to get touch receptors, touch sensation. This cells need, these cells are pressure receptors. So they sense the pressure. Okay, so basically what they work will not happen properly. They didn't work very properly. ओके, सो यहाँ पर क्या हुआ कि डायबिटिक न्यूरोपैथी किसको कहते हैं, उससे पहले समझना है हमें सेल सेल की रिक्वायरमेंट क्या है। सेल की रिक्वायरमेंट है ऑक्सीजन और एनर्जी। ऑक्सीजन हम सांस के जरिए से, लंग्स के जरिए से लेते हैं। एनर्जी हमें कैसे मिलती है? हम जो खाते हैं, जिसमें क्या होता है, आपको एनर्जी मिलती है। ठीक है, एनर्जी के अंदर मेनली जो मॉलिक्यूल है उसका नाम है ग्लूकोज। ग्लूकोज जो भी खाते हैं आप, उसमें हर एक में ग्लूकोज होता है। ठीक है, वो ग्लूकोज ब्लड में रीच होके, ब्लड से अब्सॉर्ब होके सेल तक पहुंचता है आपके खून के जरिए से। ओके, सो व्हाट इज डायबिटिक? द सेल डजंट think that it will able to take the glucose in, because there are not enough insulin cell. Okay, we will talk in detail in endocrinology about that. Okay, but here one explanation is need. That's the reason I am explaining. So the cell that doesn't getting enough glucose, so it will not develop enough energy. So if it not getting enough energy, the work of any cell will decrease. तो यहाँ पे क्या होता है, जो सेल का जो काम हो जाता है वो कम हो जाता है। तो ये सेल का काम क्या था? आपको टच महसूस कराना। ठीक है, तो जब ये टच का काम है इसका डिक्रीज हो गया, तो आपको टच महसूस नहीं होगा। तो जो चीज महसूस करना है उसको आप वो अपने अंदाज में वो महसूस कराए। So this is the reason here explain that the diabetic neuropathy, in that touch receptors are morely damaged. Okay. As for the skin itself, if you have ever had poison ivy or chicken pox, you may remember that itching sensation of the rash. And itch is actually a mild pain sensation which may become real pain if not scratch. Why does scratching help relieve some itching? Besides by removing an external irritant, one proposed mechanism is that scratching is a bit more painful than the itch, and the impulse it generates can distract the brain from the impulse from the itch. Scratching will not help relieve the itch of poison ivy, chicken pox, or mosquito bite. However, because the irritating chemicals are in the skin, not on it, in such cases, scratching may do more damage and worse inflammation at the sites. Here, one more sensation they are explaining, that itching. Itching also a sensation. Why do you have itching? Why do you have itching? Because there is an irritating pollutant is seated on these receptors. Okay. So what the receptors want to do? Receptors want to throw the irritant from that area. So we want to itch that area. We will scratch that area and we want to remove the pollutant from outside. So if the pollutant is in outside, it will remove and we will get relief. Okay. But if the pollutant is sitting in the cutaneous level or subcutaneous level, if you are scratching your skin, it will may cause more damage to the skin, because the pollutant is inside the skin. If you scratch, you will not remove the pollutant. Okay, again you will get the damage. So here one, two, three examples are given that you may get itching in the skin, chicken pox. You know, chicken pox, small uh, pus like, uh, pimples like structures are all over the body. Okay, so that is the thing, and as well as mosquito bite. Okay, the things. or any allergic reaction. Okay, so these are the simple examples when you will get itching. Okay, so बेसिकली यहाँ पे क्या बता रहे हैं कि आप बता रहे हैं कि इचिंग इचिंग भी एक क्या है, एक सेंसेशन है जो आपको महसूस होती है। तो क्यों होती है इचिंग? इचिंग इस वजह से होती है कि जो हमारे टच रिसेप्टार से उनके पास कोई केमिकल सब्सटेंस आ जाता है, कोई पोल्यूटेंट आ जाता है। ठीक है, अगर वो पोल्यूटेंट बाहर से है तो जब आप इचिंग करेंगे तो आपको रिलीफ मिल जाएगा और वो पोल्यूटेंट वहां से निकल जाएगा, तो टच रिसेप्टर्स एकदम फ्री महसूस करेंगे। ठीक है, लेकिन अगर वो पोल्यूटेंट हार्मफुल है, जैसा कि कोई मच्छर आपने काट मच्छर ने आपको काटा, मच्छर ने अपने अंदर से एक लावा को छोड़ा और वो केमिकल है, तो उसको आप अंदर से निकालना पड़ेगा, बाहर से तो नहीं निकाल सकते उसको। जैसा कि आप दूसरा एग्जांपल चिकन पॉक्स, ठीक है, पूरे जिस्म में आपको क्या हो गए, घाव हो गए, उसकी वजह से आपको इशिंग आ रही है। या फिर कोई एलर्जिक रिएक्शन हो गया, कोई चीज आपको नहीं जमती वो आपने खा लिया, जैसे कि खासकर प्रॉन्स, झींगे होते हैं जो बहुत सारे लोगों को नहीं जमता। ठीक है, खाने के साथ ही उनको इचिंग स्टार्ट हो जाती, तो एलर्जिक रिएक्शन हो गया। ठीक है, तो ये कंडीशंस में क्या है, आप खुद जाके उसको ठीक नहीं कर सकते, उस मौके पे आपको मेडिसिन की जरूरत पड़ती है। ओके, दिस इज द अनदर एग्जांपल ऑफ टच। The sensory areas for the skin are the partial lobe. You may recall the chapter 5. The sensitivity activity of any area of skin is determined the number of receptors present. The number of receptors correspond to the size of the sensory area in the cerebral cortex. The largest part of the sensory cortex are for the parts of the skin with the most receptors, that is the hand and the face. So here the number of receptors are present on the skin are more than any part of the body, because it want to, because it is the upper part of the body and it will take the sensation outside the environment. So that's the reason we have number of receptors in our whole skin, but more number of receptors are present in hands and face. So in the body we have more receptors in the skin, from on the skin, from more than the receptors are present in hands and the face. So हमारे बॉडी में जो है सबसे ज्यादा जो रिसेप्टर्स है, जो सेंसेशन को या फिर कोई भी फील को महसूस करते हैं, वो अपने स्किन में है, हमारे स्किन में है। और स्किन में भी सबसे ज्यादा कहाँ पर है, हमारे हैंड्स और फेस। इसीलिए कोई भी छोटी से छोटी चीज भी हम महसूस कर लेते हैं जब हमारे हाथ को कोई लग जाए या फिर हमारे फेस पे आ जाए, क्योंकि यहाँ पे रिसेप्टर्स एकदम बहुत ज्यादा। ठीक है, अब ये सेंसेशन यहाँ से लेके जाने वाला एरिया कौन सा है, सेंसरी कॉर्टेक्स। ब्रेन में क्या है, सेंसरी कॉर्टेक्स। यू कैन सी इन द इमेज सेंसरी कॉर्टेक्स। फॉर डिटेल एक्सप्लेनेशन, दिस इज द सेंसरी cortex. Okay, these are the all areas you can see: functional, sensory, somatic, vision. Okay, this is the sensory. These are the sensory cortex. So here we have the sensation. You can see in our on our brain. Okay, this is present in parietal lobe. Okay, this is the frontal lobe. This is the parietal lobe. You can have middle frontal plus parietal. In the between parietal and frontal lobe, this is the occipital. This is the temporal lobe. Okay. As mentioned previously, sensory areas are not merely passive recipients of impulse. Consider the sensation of wetness. It is distinct sensation, but there are no receptors for wet in the skin. Where does the sensation come from? Where all sensation come from the brain. The parietal lobes have learned to associate the stimulant's reception of temperature and pressure impulse with wet. You can demonstrate this is for yourself by putting on a plastic glove and dunking your finger in a cup of water. Your fingers will feel wet, though they are perfectly dry inside the glove. Wetness is learned sensation created by the brain. So one more sensation is given here, that is wet sensation. But we doesn't have any wet receptors in our body, but we can feel the wetness. So why this happened? Because the wet in the water we have the temperature, so you have temperature receptors. So with that help of temperature receptors, the brain determined that there is any other thing that is doing uh, giving sensation to the touch receptors. So if you want to do the example, you can do that. This is given here. You wear the gloves. Okay, you wear the gloves and you put the finger in the water tub. You will feel the sensation of wetting. Why? Because the temperature inside the water is going to the receptors to the brain. So brain is assuming that this is the sensation of water, wet water. Okay, you can do this experiment in your home. You can observe that. So यहाँ पे बताया जा रहा है कि एक सेंसेशन है, क्या है, वेटनेस, कच्चापन। तो ये कच्चापन भी क्या है, एक सेंसेशन है। ये सेंसेशन आप महसूस कर सकते हैं। कैसा महसूस कर सकते हैं? हालांकि आपके हाथों में और स्किन में कहीं पर भी वेट रिसेप्टार्स नहीं है जो कच्चापन को महसूस कर सके। लेकिन किस तरह बॉडी इसको महसूस करती है? हमारी बॉडी के जो ब्रेन है वो डिटरमाइन करता है कि ये क्या है, एक कच्चा है, चीज है। किस तरह? टेम्परेचर की बुनियाद पर, उसके अंदर की जो ठंडक है वो ठंडक की बुनियाद पे महसूस करता है कि ये वाटर है, ये वाटर से है, हमारा हाथ कच्चा हो सकता है। Okay, so this is the all about cutaneous sensation. So whatever cutaneous in this on the skin we have, we talked about different types of sensation, how the sensation we will consider by our brain, determined by our brain, we learn. Okay, you have to remember that. Next is referred pain. So here referred pains means some person have neck pain. Okay, neck pain. The pain is coming from the neck to the shoulder. The person feeling pain here, but also the pain coming to the shoulder. So this is known as referred pain. Some patients have back pain, okay, lumbar pain coming in your clinic. He have back pain, and also he's telling the pain is coming to my thighs. Okay, sir, I have pain in my thighs. Could you do anything to me? You will treat me? Okay, why not? I will treat you. Okay, so रिफर्ड पेन का मतलब क्या है? ये पेशेंट आ गया आपके पास, कहने लगा कि सर हमारे गर्दन में दर्द है, और साथ में ये दर्द यहाँ कंधों तक आ रहा है, और ये कोहनियों तक भी आ रहा है, ये हाथ तक आ रहा है। सो दर्द हो रहा है यहाँ पे, लेकिन दर्द यहाँ तक खींच रहा है। सो दिस पेन इज नोन एज, इस पेन को क्या कहेंगे हम? रिफर्ड पेन। तो बहुत इंपॉर्टेंट है। ठीक है, एक पेशेंट आया आपके पास, कमर का दर्द, बोल सर कमर का बहुत दर्द हो रहा है मुझे, और साथ में दर्द यहाँ पे हो रहा है, लेकिन ये पूरे कमर के हाथ, ये हमारे जो पैर है, पैर के नीचे तक आ रहा है। तो क्या मतलब है इसका? इसका मतलब इसको रिफर्ड पेन। और कुछ लोग कहते हैं कि some persons tell I have chest pain sir, the chest pain is coming to the back and along with the pain they're coming to the shoulders. तो ज्यादातर हार्ट अटैक पेशेंट्स को होता है, चेस्ट में पेन होता है। पहले बोलते हैं सर यहाँ बहुत दर्द हो रहा है, बहुत दर्द हो, घर वालों को कहते हैं। फिर उसके बाद कहते हैं कि पेन यहाँ पीछे आ रहा है, हाथ में आ रहा, पीछे आ रहा। ठीक है, और पसीने जाते रहते। सो इसको क्या कहेंगे? रिफर्ड पेन। Okay, so the free nerve ending are also found in the internal organs. The smooth muscle of small intestine, for example, has free nerve ending that are stimulated by excessive stretching or contraction. The resulting pain is called visceral pain. Sometimes pain that originates in internal organ may felt cutaneous area. This is called referred pain. The pain of heart attack, myocardial infarction may be felt in the left arm and shoulder, but the pain of gallstone may be felt in the right shoulder. The referred pain is actually a creation of the brain. Within the spinal cord are sensory tracts that are shaped by the cutaneous impulse and visceral impulse. Cutaneous impulses are much more frequent and the brain correctly projects the sensation to the skin. When the impulse comes from an organ such as the heart, however, the brain may still project the sensation to the usual cutaneous area. The brain projection projects sensation based on past experience, and cutaneous pain is far more common than visceral pain. Knowledge of referred pain as example mentioned earlier may often be helpful in diagnosis. So what is referred pain? Basically, every nerve is connected to each other. Okay, every nerve is connected to each other. So if the nerve ending, one of the nerve ending is feeling the pain, so because the one nerve is connected to that nerve also, So the receptors which are getting the pain, okay, the sensation of the pain also will touch the parallel receptors also. Okay, whatever receptors are present. So this is the why this is happened, because the brain, because of creation of the brain. This is the answer is here. This is the creation of the brain. Brain, it divides the pain. So if the pain is not same area, we cannot bear the pain. So what the brain is doing, brain is uh, want to decrease the pain from that area. So that is the reason. So it is dividing the pain. Some receptors also getting the pain touch. Some receptors from the other area also getting the pain. So that it is divided. So if it is divided, you can bear it. One thing, the brain is dividing. Second thing is, if you are getting the pain, you will want to take the action. What you will do, you will take the action. We have to treat the problem. We have to do anything to decrease the pain. Okay, these are the things the brain will do. Okay, so this is how happening. Mostly, we have we have the pain on the pain will on cutaneous area or internal area. Internal means visceral area. So if like example, one example is given here in our intestine, small intestine, large intestine, there are lot for millions of nerve endings are there. We cannot assume that if a patient have constipation or any gastric disturbance, so mild gastric disturbance also create a lot of pain in the stomach. Why? Because there are millions of nerve ending in our digestive tract. So if some nerve ending feeling the pain, so it will refer. It will send some amount of pain to the other receptors, whatever nearby area are there. Like same example is for chest pain. So you have heart attack. If anyone have heart attack, so heart attack means the heart is cannot work properly. Okay, myocardial infarction means heart is not working properly. Heart is not getting enough blood. Okay, that's the reason I told you blood is the only thing that every cell need, because in the blood only all the things are required by the cell is present. So our heart is not getting enough blood. So the person me, the heart will stop for some time, for some seconds, not some time. For some seconds, the patient feel heart pressure in the heart region, pain in the heart region. So so the around nerves are present, which are present in around the nerves, around the heart. So the nerves will divide the pain. So that is the region the person feel the pain in the shoulder, backside of the chest region. Okay, so this is called referred pain. Okay, understood. Next is muscle sense. We have muscles. We have cutaneous sense, and next we have below the skin we have muscles. Muscles, about muscles we talked about in chapter 7, okay, and briefly. Basically, muscle sense detect stretching of muscles and generate impulse which enable to the brain to create a mental picture to know where the muscles are and how they are positioned. Conscious muscle sense is felt by parietal lobe. Unconscious muscles is used by cerebellum to coordinate voluntary movements. We do not have to see our muscles to be sure they are performing the intended action. Muscle sense also contributes to our ability to distinguish the shape of objects. So basically, the muscle sense is nothing but it is also uh, getting from our cutaneous area only. And another thing, it is explained here that the muscles which are present, whenever we move the muscles, okay, consciously we are moving. I am moving my hand. I am moving my here mandible, maxillary muscles. Okay, okay. I'm talking. I'm explaining. So these are the conscious level of muscles. So I am knowing that I am uh, moving the muscles as well as my hands. I am moving my hands means I am aware of moving this hand. But internal organs like heart, these are also muscles. Stomach, intestine, kidney, every organ is made up of smooth muscle. But I don't aware of it. We also other persons also don't aware of it. So how these muscles are doing their work by unconscious muscle sense. This is called unconscious muscle sense. Which organ is taking charge of it? By cerebellum. Who is cerebellum? Let's see by image only. Parietal lobe we have. So this is the parietal lobe. This is muscle conscious muscle sense aware of cerebellum. This is the cerebellum. Unconscious muscle sense is sensed by cerebellum. Okay. Next we have sense of taste and other sense of smell. Other things are there. Okay. So I think today we can stop here only. If you have any doubt, you can ask.